Perfect. So, hello, my name is Kira, and I will be doing your intake session today. What is your name?
My name's Ashley Smith.
Ashley Smith. Okay. Nice to meet you, Ashley. And what's your date of birth?
My date of birth is 3/26/1998.
And how would you identify ethnically?
White, non-Hispanic.
So, just our session today is just going to be brief. We're just going to go over some intake questions and see just kind of what's going on with you. But first, before we discuss that, I just want to let you know about confidentiality. So anything that we discuss in this session will stay in the session, except for the case of child abuse, neglect, harm to yourself or others, or for any court and legal insurance reasons. Is that okay for you?
Yeah, that's fine with me.
So tell me a little bit about what's been going on.
Yeah, so I just have had like a lot of worry about stuff lately.
Mhm.
It's kind of kept me up at night. It's like at night I just have a lot of worry and so
Mhm.
I've been really restless. But just mainly a lot of worry about stuff that I feel like I really can't like I can't control the worry.
Mhm. And is there a particular event that's happened that you're maybe worried about?
Not that I can really think of. I switched jobs about 8 months ago, but I mean, I know the job and I know what I'm doing, so it's not like that's what's worrying me.
Okay. Okay. And who made your referral? Was it a doctor, a therapist?
Yeah, it was my primary care doctor. He had just kind of referred me when I went in for my yearly because I just expressed kind of feeling that worry and he thought I should reach out.
Okay, okay. And about how long have you been dealing with these symptoms?
I'd probably say it's been between 6 to 8 months.
Okay. And would you say it's um like on a scale from like 1 to 5, how much is it impacting your day to day?
Probably a 3 to a 4. I'd say it's m more days than less in a week.
Okay. Okay. I'm sorry you're dealing with that worry. And with these symptoms, have you ever experienced currently or in the past any suicidal ideation, any thoughts of harming yourself or others?
No, no, I haven't really thought about that at all.
Okay. And have you seen a psychiatrist or therapist in the past?
No, I haven't ever seen anyone kind of like this.
Okay, so it's your first time.
Yeah.
Okay. And have you ever taken any medication for mental health in the past?
No, not anything that wouldn't be like just ibuprofen for a headache or something.
Okay. Okay. And so before you started dealing with this worry and such, have you ever dealt with any mental health struggles prior to this?
I don't think so. The worry's kind of a new thing for me.
Okay, okay, all right. And so now that we've got that, just kind of getting the background, we're just going to get into some family history, if that's okay.
Yeah.
If you see me looking to the side, I'm just typing some notes just to make sure I'm keeping track of our session. Um, so do you have a family history of any psychiatric or mental disorders?
No, not that I can think of. My mom was a single mom, so um I mean, I imagine she might have dealt with some stuff, but nothing that anyone ever got diagnosed with.
Okay. And so I guess we can talk a little bit more about your parent and childhood. So could you give me a little background on your parent situation and if you how your childhood was?
Yeah, so I mean, I'd say I had a relatively good childhood. It was my mom, and then my dad had passed away when I was 2, so I didn't really build a relationship with him. And
Okay.
then I have an older brother and a sister, so I'm the youngest.
Okay. Sorry for your loss with your dad. Was that a significant loss for you or?
I think it's hard to compartmentalize it just because I was so young. So it's not like I had a big bond with him, but seeing how it affects my mom was definitely something I struggled with.
And then you said you had two siblings.
Yeah.
Okay, and you're the youngest.
Yes.
Okay. And any other family history of abuse or anything that I should be aware of?
No, I don't. I think I had a relatively good childhood. I wouldn't say anything was ever outside of the norm for discipline or anything like that.
Okay. Okay. And do you currently use any drugs or alcohol?
No, not outside of like occasional use on the weekends or something like with friends. I might have a drink or two, but that would be
Okay.
it.
Okay. And any history of substance abuse on your end or any family end?
No.
Okay.
My mom was pretty anti doing that stuff since she was a single mom. She didn't really have time to partake in
Yeah.
any of that.
Yeah. And so that's just covering our past, your past relationships and such. Now we're going to get more into your current. Um, if you want to tell me a little bit more about your current relationship, if you're married, have kids.
Yeah, so I don't have any children. Um, I'm currently with my boyfriend. We've been dating for about 1.5 years. It's only my second relationship ever, so I don't have like a huge dating history or anything, but not
Okay.
married, just my boyfriend, no kids.
Okay. Okay. And what's your highest level of education?
So I completed high school and then I took a year off, but then I went to college and I did earn my 4-year degree in accounting.
Okay. So you have your bachelor's in accounting.
Yeah.
Okay. Okay. Making sure I get that typed right.
hmm
Okay. And are you currently employed?
Yeah. So it was the about I think 6 to 8 months ago that I transitioned to this new job.
Okay.
It's working kind of more like on the behind the scenes for like a medical center of like the billing portion, just the accounting on that.
And how are you liking that job?
I like it fine. I know the job, I know what I'm doing, but that like worry and the stress kind of overtakes my workday sometimes, and then I kind of have like a blank space and I don't really know. I don't know. It's like I can't complete the tasks at hand because of it's like my
Mhm.
mind's blank.
Yeah. Yeah. And when you're having that worry and stress, is there anything like, could you describe like your thoughts that you're having if you're having any thoughts, or maybe some like bodily reactions that you're having?
I think sometimes I get very like shut down and closed off from other people. Um,
Okay.
I know like sometimes before my boyfriend will want to go hang out with friends and stuff at like a social event. Sometimes I don't really want to go because I kind of worry about how others will perceive me there.
Mhm.
Um, even though I know nobody's really thinking about me that much, but it feels that way sometimes.
And is that your main concern, is that the social situations can be overwhelming?
That and
Or
then at night it's really hard to sleep because it like
okay.
the worry comes at night and it keeps me up and because of
Mm-hmm.
that sometimes I feel like it causes me to be really tired the next day um, just
Mm-hmm.
because I am being kept up so late at night.
Yeah, yeah, that's understandable. Sorry you're dealing with that. Hopefully we can, moving forward, we can maybe brainstorm some things together and how we can better work to manage those feelings that you're having. And then just going back to some more background information, um, any history with the military with you or your family?
No, I don't believe that my dad ever served and I know my mom didn't and haven't ever been in the military.
Okay. Okay. And any history of sexual abuse, any abuse overall, verbal, physical, emotional?
No, I wouldn't say that's happened in any of my relationships, whether it's romantic or family.
Okay. Okay. And so with going back to your symptoms of the worry and just the restlessness, it seems like, are you using any current coping mechanisms to help you manage those feelings?
I think it's hard sometimes to like know what I should be doing or what I
Mhm.
could be doing to kind of help those symptoms and those thoughts.
So currently no coping mechanisms. Is that what I'm hearing?
Yeah, I mean, sometimes I'll talk to my boyfriend about it. He's really understanding. Um,
Okay.
but outside of that, I don't really know what else to do.
Okay. Okay. So is boyfriend a good social support for you?
Yeah, I would say so.
Okay. Okay. And other than boyfriend, do you have anybody else like a social support?
Outside of my family, I mean, we're really close. I would include my siblings probably in that.
Okay.
But mainly just them.
Okay. Okay. Would you consider because I know you mentioned your siblings and your boyfriend, would you consider your mom a social support as well?
Yeah, we were close with my mom. I think sometimes it just would make me feel bad to like put any more onto her than I know she's already dealing with. So I really
Mhm.
just rely on my siblings and my boyfriend for that kind of stuff.
Okay. Okay. Thank you for that. So I just have a couple more questions. Thank you for sharing and being open and honest with me. Any legal trouble in the past or currently?
No, not anything outside of like a speeding ticket, but nothing current or anything worse than that.
Okay. And any medical history, head injuries, chronic illnesses, hospitalizations, allergies?
Nope, nothing like that.
No, pretty healthy.
Yeah, luckily so far.
That's good. That's good. Okay. So that's all of the questions that I have for now. Do you have any questions before we kind of go over potential some treatment options?
I don't think so.
Okay. Okay. And so just to make sure I heard you correctly and making sure that we aim the treatment in the right direction, it just seems like you're just dealing with some worry that's affecting your work, social situations, and sleeping. Is that correct? Did I miss
Yeah,
anything?
I would say that's correct.
Okay. Okay. So as far as treatment, would you be interested in perhaps a medication? Did you want to maybe work on how to deal with that stress of social situations, or did you want to maybe go towards like a talk therapy kind of route? What were you thinking as far as your treatment?
I'm kind of open to, your thoughts since you're the professional and kind of what you think's best, but I'm hesitant to try medications just because I've never really been on anything like that. So
Mm-hmm.
that just feels like it would be a really big jump. So I think I'd rather stick to like some sort of like therapy and just talking with you.
Okay, okay. And that's okay if you don't want to try meds. They're not for everyone. And we'll definitely try while I may be the professional, you're the professional of your own feelings and how you want your treatment to go. And so we'll definitely stick to something that is more comfortable for you.
Okay.
So that's all that I need to cover right now. So I thank you for coming in and taking time to do that. Do you have any last questions before we end our session today?
I don't think so. I think I kind of needed to get off my chest everything I was kind of feeling to you.
Okay, well, thank you for sharing, and we'll get you scheduled for maybe about a couple days or a week out for your next session.
Okay, sounds good.
Thank you.
Thank you.